you, Representative Cardenas. Again, I'm Representative Randy Fries from Legislative District 9 in Tucson. I'm also a physician. I have an active practice at the University of Arizona Medical Center, Banner, University of Arizona Medical Center, Tucson. I'm a trauma critical care surgeon, so I'm on the front lines of delivering health care. If there is a repeal without replacement, that is pure politics. And we need to be focused on good policy. And that's something you should demand of your representatives. So also, as Mark mentioned, 700,000 Arizonans will be without health care if there is a repeal without replace. I introduced last week HCM with 2004, which is basically a note to Congress from our legislative body here in Arizona urging them, do not repeal the Affordable Care Act without an immediate adequate replacement. And what we mean by adequate is maintaining, being able to have coverage under your parents' health care until age 26 if you're a student, maintaining no lifetime limits, and maintaining no pre-existing conditions clauses. And also keep the subsidies that fund this program. Now, I probably won't be able to say this very much, but Governor Ducey and I have found common ground on this issue. And I want to say, and I'll quote Governor Ducey, we must implore Congress, don't pull the rug out from under Arizonans who need health care. Thank you.
Hello, everyone. Hello. My name is Paula Christensen Silva. I'm a nurse and a nurse practitioner from Tucson, and I'm honored to be here on behalf of the Arizona Nurses Association. I'm here as an advocate for my patients, many of whom will lose the ability to obtain the care they need if proposed changes in healthcare laws and regulations are enacted, and also to highlight some lesser-known but important sections of the Affordable Care Act. The 63,000 nurses in Arizona are educated, highly qualified, and trusted to provide effective and compassionate care. We practice in major hospital systems and in small community clinics and practices. Nurses advocate for our patients, helping each to obtain the right care at the right time and in the right place. We believe that basic health care is a human right. Nurses believe that cost-effective preventive care saves both lives and money. Title 4 of the ACA focuses on preventing chronic diseases and improving public health. If the ACA is repealed, the following programs will disappear or be drastically reduced. 1. Worksite wellness programs, in which nurses provide health education, blood pressure monitoring, and flu vaccines. 2. The Family Nurse Partnership Program, where first-time vulnerable mothers and their babies receive home care and parenting education from a maternal child nurse. Research has demonstrated the positive long-term effects of such programs. 3. School-based health centers in low-income schools. 4. Clinic and community preventive services, where nurses offer diabetes management, cholesterol education, and other services in outpatient clinics. 5. Chronic disease programs, in which nurses provide home health care or case management through accountable care organizations. 6. Community health assessments and efforts towards healthy aging, living well, and community-based prevention. This equates to $8 million in Arizona annually. Do you recall nutrition labeling at Starbucks and Subway? This is part of the ACA. Breastfeeding sites at work and reasonable break times for nursing mothers. This is part of the ACA. No-cost clinical preventive services like mammograms and colorectal cancer screenings. This is part of the ACA. Emergency preparedness, fighting outbreaks and providing emergency medical response as part of the Prevention and Public Health Fund. This is part of the ACA. Section 5 of the ACA addresses the needs of the healthcare workforce. Repeal would eliminate or drastically reduce the nursing student loan program, nurse-managed health clinics run by nurse faculty, advanced nurse education and retention grants for advanced practice nurses, and the Nurse Faculty Loan Program. These programs address the shortage of nurses and nurse faculty. All would be gone. The ACA has significantly decreased the number of uninsured Arizonans. It has increased prevention programs and services to create healthy communities. It has addressed the nursing shortage through education support for nurses and nurse faculty. Let's be smart and thoughtful about the next step in reforming our healthcare system. Thank you.
Thank you. I am Linda Somo, and I am a retired educator, but I'm also a proud member of the Alliance for Retired Americans. All right. And as such, we are here today to let you know that we are concerned about the repeal of the ACA without a replacement and how that will affect Medicare, because many of us are already on Medicare or will be soon. Many of my colleagues don't realize all the benefits that Medicare has achieved from the ACA, not the least of which is the fact that we went from a possible bankruptcy for Medicare in 2016 to now it is solvent at least until 2028. So the savings that have been achieved through the ACA have helped Medicare sustain their viability for an additional 12 years at the very least, and will continue to do so with some of the programs that were implemented through the ACA, such as the wellness visits that are permitted every year for Medicare patients. Also, closing of the donut hole. I have friends who are on multiple medications, and usually they would reach the donut hole by early in the year, like March or April, and from then on they were paying all of their prescriptions out of pocket until they reached a very large sum of money. That has been closing ever since the ACA started, and they are benefiting now with being able to have their prescriptions paid for and thus being able to maintain their own solvency and still be contributing members of our community. And not, fortunately, as a Medicare recipient, someone who has been on Medicare for over 6 years now, I am adamant about needing to protect our benefits through Medicare, not only for myself, but for future generations. I have 2 sons and 6 grandkids. I want them to have the same benefits that I have. If they repeal the ACA without the type of replacement that we are demanding, then those benefits could be lost in the future. So please join us in demanding that our state legislature convey to our congressional representatives that we will not stand for a repeal without a legitimate replacement. Thank you.
We've had a doctor speak, we've had a nurse speak, had an educator speak. My only claim to fame in the medical field is being a combat medic about 50 years ago. So I just want to talk about one of our alliance members for a minute. You've heard about a number of things that the Affordable Health Care Act protects when it protects seniors. And one of the biggest things it does protect is our prescription drugs. This story would be about me had I not have prescription drug coverage. It's a story that starts in March of 2010 when President Obama signed the Patient Protection and Affordable Health Care Act. It was the largest health reform act in our system since 1960. Under the law, Medicare beneficiaries receive free annual checkups and no longer have to pay for preventative screenings. Over the years, the Affordable Health Care Act enables seniors to save $15 billion, that's a B, $billion on drug costs. I want to tell you a story of a local alliance member named Jim. Jim didn't want to speak publicly today, but agreed to have his story told. He's a retired worker in the communications industry. See, Jim has diabetes, like many of us seniors on Medicare have. I can attest to that. Jim hit the donut hole, his prescription drug coverage, on April 1st. He will then have to pay $600 a month for his insulin. $5,400 a year is a lot of money, even for someone, especially for someone on a fixed income. Because Jim is on a fixed income, he has to make sacrifices. He has to give himself a shot every day to make the insulin last. He's canceled his internet service. He's also had to dip into his retirement savings, which is running low. He counted on the donut hole that's supposed to completely be closed by 2020, 3 more years, under the Affordable Health Care Act to help protect the little savings he had left. With its repeal, that's gone. Since Lyndon Johnson signed the Medicare into law over 50 years ago, America's promised to take care of us seniors, our most vulnerable people, those that took this country and passed it on to the next generation. Some of us are the greatest generation still living here. Retirees like Jim shouldn't have to skip a meal in order to live. Closing the donut hole is one of the many provisions in the Affordable Health Care Act that saves seniors billions of dollars in medical costs. Today, retirees stand in unison to ask our elected officials to ensure the replacement of the Affordable Health Care Act won't leave seniors broke. So, with that, I think the story of Jim and Jim's story needs to be taken out throughout the land. And we need to make sure that we're protecting not only ourselves, but people like Jim. I'm just wondering out here, if those that are willing to raise their hands, how many actually have a pre-existing condition that Portable would... How many probably have something that you couldn't even get insurance because you would have probably had a lifetime maximum because of your pre-existing conditions? Yeah. See, there are people, our friends and neighbors, people we don't even know about, that are going to be greatly affected by this. So I want to thank you all for supporting this particular issue. We need to take the fight inside today. We need to take the fight in the halls of Congress.